Hello, my name is Zhen. This video aims to help clinicians understand the shift in reflux disease management, learn about the current knowledge on reflux mechanism, and recognize the different approaches to the treatment and management of reflux disease. The following content will be covered using 3 sets of questions and answers. Traditionally, the management of reflux focused heavily on gastric acid control. Medications such as proton pump inhibitors and H2 receptor antagonists have been the cornerstone of treatment. These medications are effective in reducing stomach acid production, thereby alleviating symptoms and promoting healing. Another approach is to neutralize gastric acid to relieve indigestion and heartburn. However, there is a shift in the management of reflux to focus not only on managing the acid pocket in the stomach, but on preventing gastric content to travel up the esophagus, that is, preventing the reflux. The pathogenesis of reflux disease involves an interplay of chemical, mechanical, psychologic, and neurologic mechanisms, which contribute to symptom presentation. As such, reflux disease should be approached as a disorder beyond acid. In GERD, the major component driving esophageal mucosa damage is the refluxate, which can overcome built-in defenses of the esophageal epithelium due to its potency, composition, and exposure time to the esophageal lining. Refluxate is made up of varying levels of acid, bile, pepsin, food contents, and normal gut microbiota. The mechanism by which each component affects the esophageal mucosa is distinct, and thus the etiology of GERD may be specific to the predominant refluxate component and its mechanism of action. Lifestyle modifications are considered the foundation of gastroesophageal reflux disease management. Pharmacists can communicate with patients about these lifestyle and dietary changes to prevent reflux effectively. However, it is also important to prevent the harmful effects and symptoms of reflux through effective treatments. The primary goal in treating most patients with GERD is to manage and control symptoms. For patients with severe or complicated disease, the aim is also to prevent and treat the complications. For patients with mild and intermittent symptoms, diet and lifestyle modifications can be effective. In fact, these strategies are also crucial as a complement to medication treatment for those with moderate to severe or complicated GERD. According to expert opinion, as reported by Savarino et al., proton pump inhibitors or PPIs remain the standard treatment for patients with gastroesophageal reflux disease. However, it is important to note that some patients do not respond adequately to these antisecretory medicines. This significant proportion of GERD patients with incomplete or no response to PPIs pose a major challenge for healthcare professionals. In the current medical landscape, it is advised to thoroughly investigate patients with appropriate examinations to understand the reasons behind their persistent symptoms, rather than managing them empirically with PPIs. Empirical management risks increased costs and adverse effects from prolonged and higher than usual doses of PPIs. For patients who show a partial response to PPIs, several clinical studies have demonstrated that combining PPIs with mucosal protective medicines such as alginate or formulations containing hyaluronic acid and chondroitin sulfate, or recently with bile acid sequestrants, can achieve consistent therapeutic gain. Potassium competitive acid blockers, or PCABs, which block the potassium exchange channel of the proton pump, have been shown to improve response rates in patients with persistent symptoms despite PPI treatment. And in recent years, there has also been a growing focus on medicines that protect the esophageal mucosa and enhance its defensive properties. And this is an area that has been overlooked for a long time. These medicines have proven to be not inferior to PPIs in alleviating GERD symptoms and improving the quality of life for non-erosive reflux disease patients, both as monotherapy and in combination with PPIs. They seem to open a new pathway in the ongoing quest for effective anti-reflux medications. How do alginates work to prevent reflux? Alginates possess a distinctive, non-systemic physical mode of action rather than a pharmacological one. Choosing the appropriate alginate is crucial for effectiveness in the following key areas. The G-block structure of an alginate enhances the gel strength, leading to a reaction between sodium alginate and stomach acid to produce a low-density viscous gel that floats on the stomach contents, and this forms a physical barrier to shield esophageal mucosa and airways from gastric refluxate, therefore preventing gastric reflux. This gel barrier formed by alginates also serves as a protective layer over the stomach contents to effectively suppress the reflux of the contents into the esophagus. The alginate barrier is also vital for addressing the problem of acid pocket in GERD patients. This pocket, which forms at the gastroesophageal junction after eating, consists of unbuffered, highly acidic gastric juice and plays a significant role in GERD. A strong alginate raft can cap this acid pocket, thereby reducing or even preventing postprandial acid reflux. The optimization of mobile apps use presents exciting possibilities for enhancing the management of reflux disease treatment. At present, there are applications that clinicians can use for enhancing patient education, disease monitoring, treatment adherence, and self-management. By providing information on GERD and enabling the tracking of symptoms, triggers, and medication adherence, such applications can encourage healthier behaviors. The use of such mobile health applications can increase patient engagement and empowerment, which are crucial for managing GERD's lifestyle-related risk factors. Some applications can also personalize treatment goal setting and dosing reminders, leverage on gamification, and facilitate better communication between patients and healthcare providers. In summary, traditionally, the management of reflux focused heavily on gastric acid control. However, there has been a shift in the management of reflux to focus not only on managing the acid pocket in the stomach, but on preventing gastric content to travel up the esophagus, that is, preventing the reflux. Alginates possess a distinctive, non-systemic physical mode of action rather than a pharmacological one. They produce a gel barrier that floats on the stomach contents, forming a physical barrier that shields the esophageal mucosa and airways from gastric refluxate. Mobile application use and personalized medicines present exciting possibilities for reflux management. Recent findings indicate that individuals with GERD who are undergoing PPI therapy might also experience benefits from genotype-based dosing adjustments. Check the rest of the series to learn about the causes, symptoms, including red flags, as well as the different treatment options, both pharmacological and non-pharmacological, to manage reflux. Thank you.